are my busiest days because I have to do all of my wound notes. And dang, I really want to brighten that thing up. Can y'all see me there? Like, make it better for y'all. I'm trying, fan base. I'm really gonna have to get a new device. Anywho, um, Mondays is the busiest day for me because I have to do all of my wound cases, pretty much all of my measurements, my photos, and then I make sure I go home and chart so I can upload it for the doctors to be able to have. I don't really like to sleep on that because honestly, if I prolong it with the amount of patients that I have to see for the rest of the week, it's just too much. It really is. And I don't get anxiety, but when I be sitting back looking at all them damn notes that I got to do for the week, I'll be like, oh gosh, why did I do this to my life? It is literally no joke having to chart on multiple wound cases for multiple companies. And, you do your charting. You can include the wound information in your notes, but you still always have to do a separate note, a separate wound note where you upload your photos, your measurements, and things like that. So essentially, I'm doing 2 notes each week for wound patients, multiple wound patients. And so I don't really like to prolong that. And because if I do, it's just going to pile on top of more notes each week. And it's a hot mess. I don't even want to go through it. So when I get the opportunity to come on, if I get the opportunity to come on afterwards, a little bit later on, sometimes it's really late. I don't know where any of you guys are viewing my content, but of course I save all this to my platforms anyway. So if you want to go back and watch it, that gives you the opportunity to watch so you can see what it is that I wanted to speak to you guys about today. And I really wanted to touch bases on this topic with you all today because I have to talk about it. And a lot of diabetics aren't really sure of this and aren't aware of this because, of course, this is some of the things that I covered during some of my visits. Anywho, for those of you guys that are new to my platforms, you aren't sure of who I am. My name is Unlimited Faith 05. Off of Instagram, I'm Healing at Home on all of the platforms. You can catch me mastering Healing at Home on my YouTube channel. And I like to share variety of content on all of my platforms. I enjoy talking about diabetes. I'm very passionate about the conversation in itself and the topic. And I literally like to get on here every single week and teach diabetics about diabetes. And I speak about a variety of different topics relating to the matter and why it's important for y'all to learn how to get y'all ish together. Why it's important for you guys to learn how to lower the daily glucose levels so you can, in return, reduce the likelihood of you having these complications, because these complications can lead to a lot of concerns, debilitating things that are going on within the body that can ultimately lead to not only infections due to low immunity, but also amputations. I have so many different things that I would love to just be able to share with you guys on my platforms. And especially about the skin, y'all. I have a patient that I have been working with. I need to go back in my notes and see how long I've been working with my patient. My patient absolutely loves me. And, I just can't wait to continue to keep putting a smile on my patient's face and help my patient reach the goal that nobody has been able to reach, y'all. That is literally it for me. I don't really know how to share that to I don't, all I can keep doing is sharing these stories with you all so y'all can just feel it. I mean, so I was sick last week. I got sick. What was it? I don't remember exactly when I, came in contact with the virus, but I know when I started feeling that mug, because I called off of work Tuesday thinking that I can maybe feel better if I just relaxed and rested my body. That was a no-go. And so I ended up calling off for the whole week. And literally, y'all, the whole time I'm sitting here trying to rehab my health. As y'all can still hear kind of like the crackles in my lungs. Um, I'm sitting there thinking about hurrying up, getting back to work so I can help my patients. Because, this may sound a little OCD. It may sound a little crazy to some of y'all, but it's the truth. I just feel like can't nobody do what I can do. I'm just saying. So, I don't mean that in an arrogant way. I mean it in a way that I know I'm going to put my love and my all into helping my patients. And when I touch and I feel and I get that motion and I speak to the extremity and I'm like, hey, we got to get going on healing. Like, what's wrong with you? And so I know how to release control when it comes down to my wounds. You know what I'm saying? But not for too long. Anywho, so I seen my patient today this morning. My patient was like, girl, why'd you leave me? What happened? And I said, I didn't go nowhere. I tried to take off work. My patient was like, you didn't tell me you was taking off of work? I'm like, I did not know I was going to have to take off of work. I wish I didn't have to take off of work, but unfortunately I did. My patient was like, I was waiting for you to get back because couldn't nobody do what you do. And it really put a smile on my face because I want for all of my patients, as well as when I come on here on my platforms, for all of you guys to just be able to see how much I really want y'all to just pour back into the knowledge that you obtain from my platforms into yourselves and really execute, And so with my patient telling me that really put a smile on my face. But this is how, like, I still need to sit at home and rest. But my crazy butt, I'm so focused on getting back to work so I can help my patients. That's all I can think about. And, that's all I can think about. So anywho, I'm starting to see some progression with this wound. I did my measurements earlier and the measurements have decreased versus what they were from last week. And I'm really, really excited about that. I text a family member to let the family member know so they can let my patient know. Because a lot of times when you are or when you've been dealing with a chronic wound for some time and you haven't seen any change, you kind of lose hope. You know what I mean? And I don't really want for my patients to lose hope because the more that I can get them to see that what we're doing is working, it continue to encourage them each week and motivate them to really do what they need to do. You know what I mean? So they can get going on trying to save their extremity. And with this particular case, they weren't going to amputate the toe. They were just going to allow it to fall off. And I have a huge problem with that because, we need our extremities and our limbs. I don't care how old we are. And that is a huge blow to someone's self-esteem, having to look at something that once used to be a certain way and is no longer that way. That's a huge blow to somebody. So anywho, my goal is always to focus on saving any extremities, any, limbs, any tissues as much as possible, and then getting rid of what does not need to be there. So I've been using a certain therapy that I asked for my patient from the doctor. And luckily I was able to get the doctor to get on board. They gave me exactly what I needed. And I'm finally starting to see results, later. I think it's been, I want to say maybe 2 months I've been seeing my patient. Y'all don't quote me because I don't know. I got so many different patients, but I know it can't be no longer than, it can't be any, it can't be any longer than that. Because I don't think in September I was seeing my patient. I want to say October, November, and if it was September, maybe late September or mid-September, but we didn't actually get going on the actual order until a couple of weeks after or a few weeks into seeing my patient because it was really hard to get the order going from the doctor and get everything going. And so, anywho, although the wound may appear to look like it's getting bigger, when I actually did the measurements today, I was able to see that the wound is shrinking. And that's why I love doing my measurements every Monday, because the skin is not going to lie to you and tell you anything other than what it is. And this will allow me to know and let the doctor know that what we are currently doing is working. and I don't do stuff that don't work. That's a waste of time. So I was super happy to see that. And more importantly, I was happy to be able to report it back to my patient's family members so they can let my patient know, because, everybody just want to be able to save the scenario, save the situation, save the tissue, save the wound. And so I had to really get my patient to see during the visit that, look, we need to be able to see where this edema is coming from. But in order for me to know where this edema is coming from, because they've taken my patient off the antibiotics, I need you to keep this extremity elevated. And then when you feel like you're tired of that position, reposition it. But you know what I'm saying? Reposition it in an elevated position. Now, if you're going to allow your extremity to float for a second, that's fine too. It just can't stay like that, because I need to be able to see the actual cause of why you're having the fluid retention. Is this due to or is this due to an infection? Because they've taken my patient off of the PICC line, which I really hated that they take my patient off the PICC line, because any type of wound, especially if it's something relating to what I'm dealing with this particular patient, it's good to be on prophylaxis antibiotics, because this is going to just help the process along the way, right? You can also use antibiotics that is internal, and also something that's topical. And so that is what I'm currently doing at the moment with my patient. However, my patient is no longer using a internal antibiotics, you know what I'm saying, where it's through the bloodstream via the PICC line. They removed it. And so it always drew me back into them saying they were just going to allow the toe to freaking fall off, which is what I'm like, what are we doing here? Why are we going to allow the toe to fall off? Why can't we? And this is why I can't wait to prove their ass is wrong. I'm so serious, y'all, because they want to have my patient be under the assumption that there is no blood flow to the area, where if I can prove that, this wound is getting smaller, which as I know today it is based off the measurements, and if my patient is telling me that they're still having filling, AKA we must be having some blood flow there, right? And also I can get a color change to occur on that toe and on the extremity, which is what I'm starting to see, I know that there's blood flow. It may not be the type of blood flow that we would like, because my patient is not ambulatory as in you and I would be. We can get up and go walk in and go run in it. You know what I mean? Move around on our own without assistance. This is not the case for my patient. However, small changes, I always tell y'all, lead to big changes. And this is a huge change for not only myself, but for my patient, more importantly, because this can encourage my patient each and every week. And by them seeing the changes, this is going to help them work even harder with me. So I was telling my patient, I can't do this alone. I can come in here and I can do this wound and I can teach you as much as I can. But in the end, I need you to focus on what I'm telling you. I need you to execute on what I'm telling you. And I need you to help me get the root cause, because then I can advocate for if I feel like you need antibiotics again, right? Because ultimately, if you have an infection in that wound, right, and swelling is there and you're not seeing that the swelling is going anywhere, it could be due to the infection. However, I don't see any other causes of that. So if we have this swelling and fluid retention, it could be due to heart problems, kidney problems, poor circulatory problems, right? But it can also be due to the infection. I want to rule out the infection because I'm okay with the other stuff. And y'all don't get on me talking about, what are you talking about? No, listen, we're talking about A, B, C, D, right? What's more important, right? It's just like if I don't have to worry about breathing problems, I'm going to focus on the next concern, right? So the next concern in my scenario with my patient, right? Because we don't have those main concerns. My main concern is focusing on this not being fluid retention due to, or swelling and edema due to an infection. Because once we have an infection, and that infection it has reached a certain level in the bone, right? It's called osteomyelitis. The doctors don't have no other choice but to cut it off. And this is how we get to amputations, right? And so my overall goal with all of my patients is to prevent amputations. So I have to rule out these things along the way. And I always tell my patients, I need y'all help. A lot of people feel like when you can't do one thing, then you can't do the next thing. And that's not true. You may not be able to do one thing, but you can do the other thing, right? Just by listening to what I'm telling you and then learning how to execute based off what we have to work with. If you are not, and I'm going to give you an example because I speak to y'all about this all the time on my platforms. If you are a diabetic and you are dealing with insulin resistance, but you are, not active, right? You're not ambulatory, you have physical restrictions. Well, we can still combat the daily glucose levels and learning how to lower the daily glucose levels. It may not be with the option of getting up exercising 30 to 45 minutes per day, but now we have to utilize other options that we have. And that's basically what I'm trying to say on my platforms. Looks like a hard-head patient. No, my patient isn't hard-headed. I'm just going down a list of different things and scenarios that we deal with on a day-to-day basis. And some of y'all are dealing with y'all family members as well. If not y'all family members, y'all selves. But I don't have that problem. Everybody has some sort of way that they're stuck in their way, right? And you have to learn new things. And sometimes it's hard for people to learn new things. That doesn't make them hard-headed. It's just, it makes it to where it can be a bit challenging because people are stuck in their ways. And to some degree, that's okay because it helps us to some degree, right? But when it comes down to things that they've never been exposed to before, sometimes it just takes a person being patient and learning how to get through all of those angles and those walls that have been up based off of the knowledge that they thought they've learned about diabetes and what's actually going on in the body. It just takes the educator to learn how to wing through all of that to get to the individual. So my particular thing with my patients are always, just allowing them. I always tell you guys on my platforms, I'm not here to beat nobody across their heads. I'm not going to even stress that to y'all on my platforms because ultimately the decision is up to y'all, right? You guys can do whatever it is that you choose to do. But I am going to share knowledge that I know is very accurate, resourceful, helpful, and, and it's up to you to start to execute with your providers and learn how to help y'all so y'all can know what to do, because it's too many times we complain that we don't have the help, but is it really that we don't have the help? Oh, I wish I could talk about something. But because I don't really know the source of why this happened, I am unsure of it. So I'm not going to really speak in detail as far as something that has happened to me, but I'm going to tell y'all just in general what I've learned working in the communities with people, period. A lot of times we say we want help, and then once we get the help, we don't really want the help. We don't really want the help because people don't really like to change. And then I come across some patients that are like, okay, let's do this. And they really do it. But for the most part, of all the diabetic patients that I've had that I've really helped, that I've seen changes within their bodies, was able to get off of certain medications, get medications decreased as far as the dosages, get off of insulin, is because they really wanted to do it. And they really were okay, and they understood and accepted the fact that this came with change. A lot of people don't really want to change. And so what they'll do a lot of times is blame the other person or, all kinds of stuff when really you just need to be honest and admit this to yourself that you wasn't never really ready in the first place. But to go back to talking about my patient is, I can't wait to see Friday, I think, is when I see my patient again, not on Wednesday, Friday. But I know my patient's going to be super happy because this is something that they've been waiting for. My patient told me, I've been praying for something like this to happen and praying for me to get a good nurse to da-da-da-da-da. I don't never take no full credit like that, you guys. I always tell y'all I, really ask the Most High to help me in all these situations. Although I've been doing this for years upon years upon years, I don't never go into any situation taking it for granted. I'm always a student. I love to learn. I love to read. I love to allow a person's body and the situation to teach me. And I go by that. I don't come with the stance of one size fit all, because it doesn't. And I've learned that with healing wounds, you have to pay attention to the skin and what it's telling you. And they all tell you things in different phases, right? Just because, and be okay with changing the order. Sometimes nurses are okay. They're afraid to challenge the doctors or ask the doctors or even trust their own, knowledge. I'm not that person, because I don't believe in continuing to do things that don't make sense. Why am I going to do that? Nobody wants to walk around with these big ass holes in their bodies, right? That's how I feel. I wouldn't want to, and I damn sure wouldn't want to leave my parent to do so. So why would I want your parent to be left like that? That's literally how I look at the situation. And so I may have used the order in the very beginning that was working, but now I'm starting to see that this phase is a different phase. It requires more or it requires less, whatever the case may be. And then I'm going to go and ask for the order that it needs. So anywho, I really want to share that with y'all. I know I went on a rant for a cool little minute, 20 something minutes I've been on here so far, but I wanted to come on here and talk to y'all about the progression, signs of diabetes progression, because I really think this is important for a lot of diabetics to be aware of this, because a lot of times y'all just don't know. And I notice this when I go out to see patients and even talking to my patients, hell, because it's a constant, continuing educational, weekly thing, and it's okay to take baby steps. It's okay to accept where you are and then learn from where you are and then continuing to keep moving. And I think this is important because for some of you guys that keep going into your follow-up appointments and you're like, dang, it seems like every time I leave the hospital or I leave my doctor, they give me a new medication or they done up the dose on the medication. This is literally what I hear, y'all, okay? Or, they want to put me on another medication even though I'm already taking this medication with that medication. Well, you know what I'm saying? We have a progression with the diabetes. And I've covered so many lives for y'all. It's not even funny. I have over, probably 100 and something lives on my platforms talking about a variety of different things, from lab work to food, to nutrition, to breaking down the body and how things correlate, how systems work together, how this symptoms trigger this symptom and this can cause you to have this problem. I mean, I've literally went down a variety of different concerns relating to diabetes to help diabetics be able to connect the dots, not only for y'all selves, but for y'all family members, if this are things that y'all are going through, because this is literally what I hear in my communities, right? And so I know that if people in my communities are suffering with these concerns and these problems, I know there's more people in the world that are suffering with the same thing. Because a lot of times you guys just aren't getting the full breakdown. You may have a brief general, hey, do this. This is what caused this. And then that's it. But unfortunately, I've learned, I can't speak about nobody else and what anybody else do as far as in their careers or on their platforms. I don't know, and I really don't care, right? What I care most about is being a resource for you guys to come to get the correct information, right? To get trusted information. And then it's really left up to y'all to execute. I don't want for anyone on my platforms to just come each and every week, listen to my lives, and y'all don't do nothing. Like, that is so pointless to me. I really want for you guys to say, okay, let me jot this down and then let me see where I fit. You know what I mean? And then let me work it on out and just see what I can do, right? Because if you are really listening and paying attention, you're going to help yourselves. I promise you. I don't do nothing that don't make sense. I reach all the success relating to diabetes because I've done enough research. And I'm not going to say enough. I still study, right? Because I always want to continue to educate myself and learn about the modern changes that not only medicine is, going in the route that it's going, but people in general, we change as well, right? So I'm always trying to educate myself on a day-to-day basis. I read every single day related to diabetes. It is not a game for me. Something to nutrition, something to the system. And I've been doing so for years. I'm not new to this. I've been doing this for years, okay? So I just want you guys to realize this is what I hear. And if you don't have any other place for y'all to be able to come to get the information, I want you to be able to come to my platforms and say, okay, I can trust the resource. I can trust the information. I can trust the knowledge. And then I can learn how to execute this with my providers, my specialists, speak to them and talk to them relating to all the sources and options that I have. Try to find out how I can get more options or what I need to do. I mean, I cover a variety of different things, certain insurance that you have, how you can go about seeing about certain services that you can get qualified for. I talk about all kinds of stuff. If you are on a glucometer, I talk about, how to operate the glucometer. I mean, I talk about everything related to diabetes because diabetics just don't have a resourceful platform to really go to with this breakdown. And I haven't done enough research or information or searching on, I haven't done any searching on these platforms to know this. I base it off of what I do in my communities to see. And that's what makes me continue to get up and do it every week. So I want to tell you guys, let me give my disclaimer before I get started. I am an educational platform only. I'm not here to be y'all's nurse. I don't tell y'all what to do. I don't tell you to start taking medications. I don't recommend medications. I actually don't like medications. However, because I recognize that people need them, is the reason why I choose to study medications, make myself knowledgeable with certain medications so I can educate diabetics related to these medications, because I see too many times diabetics are taking medications and they don't know why. And there are two different types of diabetics. I tell y'all all the time, they're the ones who don't believe that they can heal their diabetes, and they're the ones that do. And I talk to both of them because it's okay. How you choose to treat yourself in your life, that's your option. I'm not here to judge anybody. That's not my place. But I want you to be more knowledgeable. So when you start seeing certain changes in your body or certain conditions or things that are starting to arise each and every week or every month or so many months down the line, after taking the medication, you are aware that this medication could be causing XYZ, and this can help you advocate for yourself so you can speak with your providers about changing the medication, modifying something, whatever the case may be, right? Also, I do it because if you want to learn how to get off of the medication, well, then you need to know what the medication is doing in the body and what you can do to either couple that to help get off of it quickly, or that's it. Excuse me, y'all. I told y'all I wasn't feeling well last week. And I'm just trying to push myself each and every week to still come up here and show up on my platform for y'all. I heal myself naturally with a lot of remedies that I've been doing over the years. I haven't been on antibiotics in I don't know how long. But I do get sick every year, at least once a year. And I go through a series of healing myself in different phases, and it's worked for me over the years, and I'm still through that process. So I just wanted to show up for you guys regardless. I feel a little bit better than what I felt last week. I couldn't go live with y'all at all. I was looking like a hot mess. Y'all would have been like, what in the hell is this girl coming out here looking like that for? I was looking out here like a hot mess, y'all, but I didn't care what it was. All right. This week, now that I'm feeling better, I'm going to show up on my platforms. I know it's pretty late for some of you guys. Bear with me, but it's okay. We're going to get through it. Okay. That's why I tell y'all, turn on y'all notifications so y'all can get notified when I go live, because I'll show up whenever it's really convenient for me. I was trying to stick with being on Sunday mornings, and not that that's a problem, but y'all, it's Sunday. I mean, it's football season, and I like to watch football, and I'm not going to come on here all the time during football, especially if my team is playing. It is what it is. So turn on y'all notifications so y'all can get notified when I go live. But I promise y'all gonna see me each week. I've been doing this on my platforms for two and a half years. I think 2 or 2.5 years consistently. I haven't went nowhere. Y'all can go down my timeline and see all the videos, the contents, the lives, everything that I've shared related to diabetes, because that's what I enjoy talking about. So let's get into this. Oh, I was saying, do your due diligence to do your own research, speak with your provider, speak with your specialist relating to how you can execute based off of the knowledge that you've obtained, and you can learn how to help yourself. I'm not here to tell anybody what to do. I don't tell you to stop, start, recommend medications. I educate on them. And I just hope that you find what you're looking for from my platform. So let's get into it. Let's talk about how we know the progression of diabetes is near, right? Because if you're saying you're starting to notice that you can't control your daily blood sugars, if you're starting to notice that you require insulin to stabilize your blood sugars throughout the day, if you're saying you're requiring more PO medications, or you are on PO medications and your doctor has increased the dosage of those PO medications, then we know we got a problem, right? If you're saying you're starting to notice about your weight has been increased, and you know you've been doing everything that you should have been doing with your weight on a weekly basis, a daily basis, you've been doing everything that you can to monitor your weight, keep it within a certain range so you don't become more overweight or have more excess adipose tissue. This can also, unfortunately, cause the disease process to go into a way that you don't want it to go, right? We don't want it to progress. If we have reoccurrence of hospital stays, this is also going to be another reason why we know the diabetes is progressing in a way that we don't want it to progress. If we have newly diagnosis, just like I spoke about earlier with the different medications that you guys take, and you starting to notice different changes, this can also be another problem that the disease is progressing, excuse me. And my most important thing that I love more than anything is low energy. I shared content with you guys on my platforms earlier where I spoke about the poor nutrition and the poor nourishment that we have on a day-to-day basis that unfortunately can contribute to our having low energy. The diabetics that we see, or we know, if you're a diabetic and you deal with low energy, right, and you don't have the energy that you would normally have on a day-to-day basis, or you used to have on a day-to-day basis, this is also another sign that our diabetes is progressing, right? And not in a way that we like for it to, but in a very poor way. Because I want y'all to understand, you're already having a problem with the body utilizing the glucose in the way that it's supposed to utilize it, right? It can't access the cells. So unfortunately, there's resistance. And now we have this high glucose in the bloodstream all day long. And this is causing you to not have the energy that you would like to have. Well, I want you guys to also, hey, Classic. Well, I want you guys to also keep in mind how that can be a contributor, right? That's a risk factor. That's a problem. And now poor nutrition is a problem. Our weight gain, that's a problem. That can also cause us to not have the energy that we would like to have. Respiratory problems can cause us to not have the energy that we would like to have. Because I always tell my diabetic patients that's dealing with excessive adipose tissue, you have to know that with that excessive weight is going to cause respiratory problems, breathing problems, lack of energy. The tissues aren't going to get the nourished, nutrition, blood flow that it's supposed to get internally, right? Not only to the organs, but also to the surrounding tissue. So I want you guys to just keep this all aware when it comes down to, keep yourself aware when you think about, oh man, I don't have the energy. I'm tired all the time. And not even medications also. There's a lot of medications that cause tiredness, bradycardia, which is a slow heart rate, What else? Breathing problems, or it can cause tachycardia. All these things can contribute to you not having the energy that you would like to have. And so I always tell people when we have problems with that, you really need to focus on your nutrition throughout the day and what it is that you're eating. Because unfortunately, y'all, a lot of our foods is packed with, the quick food that is going to give us the quick boost of energy instantly, right? And get us going, get us up and going. What we see, convenience, everything is convenience everywhere. Buy this, eat this really quick, grab this, eat this on the go, stuff like that. But those are things, unfortunately, that is going to contribute to you having this low energy that you feel every single day, right? Also, if you're taking insulin makes you very tired as well. It also causes weight gain. There's some insulin that cause weight gain for a lot of different diabetics, and that's something that you guys need to keep in mind as well. And so I really want y'all to think about these different changes that I just spoke about to help you stay aware of knowing that the degree that the disease, is progressing into a rate that we really don't want it to go. We don't want it to. We don't want to be on insulin, y'all. Everything that I just mentioned to you guys would be the reason why you would be on insulin, would be a go-to for why you would need insulin. If you can't stabilize that sugar level on every single day, let's say you are somebody that's monitoring what your numbers are, because I have different type of diabetic patients that I speak to. Some of them, they will monitor what their ranges are, but they don't monitor what they eat. And so when I come in and I see them, I'm like, okay, I need you to monitor what you're eating, because this is how I can come in and educate you. If you just give me the basics of, I don't have pastas, or I had this pasta, well, that's not good enough for me, because me as an educator, I don't know about nobody else, I go extensive with it, because I recognize that even though, you did eat pasta, right? What kind of pasta did you consume? How much of it did you consume? All of this does make a difference. So that's why it really kills me when, we tell patients just stay away from pasta and eat very small. It's like, that's not good enough. That's why people don't know how to manage the diabetes, and they have these ranges that are high and low throughout the day, because it's not specific enough to you and what you do on a day-to-day basis. I don't gatekeep information from you all. I'm very honest, straightforward, and blunt. And if you are really listening to the things, if you're really watching my lives, you will learn something, because I am very straightforward, honest, and blunt. I don't know how to be no other way. We're all adults here, and I don't like to sugarcoat ish, right? Because ultimately that's not helping the situation, nor is it helping you. I would like for anyone that's, really learning something from my platforms, or the supporting my platforms, or listening to my content on my platforms, for you to be able to say, I took something away from that and I learned from it. And that is what's going to give me the, okay, good. This helped this person. Now let's continue to do more of this so they can get it, right? Because if I have it and I see this, hi, thank you so much for joining. I say the same thing with my patients. If I can't give you, like, if you can't come back and tell me, okay, I was able to retain that, then I feel like I didn't help you, because the overall goal is to help you retain what's being said, right? So I always tell my patients, and I tell you guys, I don't know how many of you guys are new listening to my platforms, right? But I always say, nothing is guaranteed. These platforms aren't guaranteed. When I'm with my patients, I tell them the same thing. I could be your nurse today, and then tomorrow I'm no longer your nurse, because there was an insurance change that no longer accepted us to come out to come see you. It happens all the time, right? Or people move. I mean, I've had random things happen with patients all the time that will stop their care with me. So I want to always let y'all know, utilize the time that y'all have, right? Because nothing is guaranteed and nothing stays the same all the time. And you have to know, I want you to be able to have takeaways and be able to retain the information that I provided you all with, so you know what to do in the event, you're in a situation and you're like, damn, I don't know what to eat, or, I don't know what's best for me to do. I don't know. Well, this is why I say we need to have more specific information that is more detailed to you and what you like to do every single day, right? Because my overall goal as a diabetic educator with my patients and on my platform, talking to you guys about this disease, is to prevent you guys from being on insulin. Because once we are on insulin, we are pretty much, what do they call it? Dependent on insulin. I see it all the time. And y'all know I ain't lying. A lot of y'all family members or y'all just say, oh, okay, I'm going to just give myself, two units, 2 more extra units, 8 more units of insulin. And you start depending on that. And as you start to see it every single day, you rely on it and you're like, I know I'm gonna be okay. I can just go ahead and sneak this and eat that, and I'll give myself extra insulin and I'll be okay. And you get further and further away from learning. Hi, thank you so much for joining, Jackie. You get you get further and further away from learning how to lower the diabetes, the A1C, how to manage the blood sugar levels every single day so you don't require insulin, because you've learned to rely on the insulin to keep yourself low. And we don't want to get on insulin. We want to get off of insulin. We don't want to be on insulin. Okay? The longer we are on insulin, the longer you are stopping your pancreas from secreting its own insulin. Do y'all research. I'm not telling y'all nothing that you can't figure out or find out or research on your own. It's just, as nurses, we have access to different databases that you guys may not have if you're not in the healthcare field. And of course, I do a lot of reading from journalists, research papers, all kinds of things. And so, I'm constantly embedding my mind, my every soul, cell, everything in me relating to diabetes, so I can genuinely help people, effectively help them in a way to help you. Like, hello, wake up. I don't mean to be snapping my fingers to y'all that's on my platforms, but I'm just being honest. Y'all gonna have to wake up, because I think that people don't take the disease seriously. And then before you know it, we're at your door. You're gonna have a home health nurse like me knocking on your door like, hey, hello, how you doing? I'm your new nurse. Excuse me. I'm gonna be at your door like, hello, I'm your new nurse. How y'all doing? This is what we gotta do. And I don't take it easy. I work with my patients with where they are. I don't force them, because I'm not here to force anybody. But I don't believe in doing stuff that don't make sense. I refuse to, because I'm results driven. Who wants to be the loser? Like, think about that. Do y'all aim to do stuff to be the loser in life? That's hell no. Nobody does that. I know we like to teach our kids like, oh, it's okay. You tried. Yeah, we do. I teach my kids that too. But I also teach them to work hard, right? To work harder than work hard. Because who wants to lose at something? You want to reach the results that you ultimately are trying to aim. That's okay. There's nothing wrong with that. That's a good thing, right? And so this is why I'm so big on telling you guys to monitor the diabetes, write everything down, really know your body and how to help it based off of what you are experiencing every single day. I'm trying to find, I need to get better prepared, girl. I be coming out here live and I just be like, let's go, let's get going. And my ass looking for my thing and I can't even find it. Just raggedy out here. I can't even find it. I'm so mad at myself. Dang, I gotta look for it. Where we at? There we go. The Most High be like, girl, you tripping. I had it right around the corner for you in your office. I'm a little set up, okay? This is why I tell y'all need this in y'all lives, okay? Y'all need this in y'all lives, because this is going to help y'all. So many different levels. This is my diabetic logbook that I have created, not only for my patients that they use, but also for y'all to use. If you don't have one, you can click the link in my bio, Facebook, You guys have a link that's attached to this live. Y'all can click that click the link and gain access to it now. This is going to help you. Okay, this is going to help us help you, because if you do not learn how to manage the diabetes, you're going to have a home health nurse like me come out and be your nurse. And when we come out, it ain't because of nothing good. It's bad, right? It's medication management skills that need to be had. It's a disease process that need to be learned. We're trying to prevent the hospitalization stays of yours from going up, and we want that to be reduced and bring it back down. If you have wounds, we're trying to prevent, amputations and infections, and we're trying to teach you how to heal the wound, how to take care of the body part. I created this logbook because I seen that it was necessary for diabetics to be able to have something to log every single day, because diabetics don't understand why this is important, why you guys need to log these numbers. If some of you guys are on medications that you don't want to be on, or you notice when you're taking the medication is causing certain problems, this is going to help advocate for that, right? That change. This is going to be the reason. Some of y'all be going into y'all doctor's appointments and just be like, oh, I'm not taking this medication no more. And that's just the wrong thing to be doing. We need to have a legitimate reason. We need to have proof on why us medical professionals, your doctor, decided to take you off of a medication. And you're going to be able to prove these changes because you've been logging them down every single day to note and show what has been happening every single day. If you know you have been working really hard on your eating and dieting and exercising, and you're just not seeing any changes, guess what? This is going to help advocate why you feel you may need to see an endocrinologist, why there may be some hormonal imbalances going on in there, right? Because now you have proof that we can see every single day what you've been doing, because that's all we want to see is what have you been doing. Some of you guys say, I don't get the help. I don't know what to do when I go into my follow-up appointments. I can't get my doctor to listen to me. I don't feel like I'm getting any of my questions answered. Come in there prepared. Come in here with the information that we need, so when we see you, we know how to be like, okay, I see what you're talking about. I see this on such and such date and time. Situations, positions is what I mean, not situations, positions, certain arms, whatever the case may be, extremities, all those matter when it comes down to coming up with a therapy regimen for you guys. And I don't think that people, because of the lack of awareness and understanding of it, people don't really have the full breakdown and knowledge to why it matter. Okay, so that's definitely going to help us be able to help you, and we can teach you how to learn how to lower the diabetes, aka the blood sugar, every single day. If we work on lowering the blood sugar every single day, this is going to in return lower the HbA1c, the A1C ranges, and this is going to help you accomplish that, because we are now seeing what you're doing on a day-to-day basis. We can encourage you because we can monitor the weight. We need to monitor your weight. We need to know exactly your weight goals that you're trying to reach and how we can help you obtain that goal, right? Just by everything that's listed in that diabetic journal. So y'all can click the link in my bio and y'all can purchase that if you guys do not have one. And Facebook is attached to that link. So I really wanted to, state this to you all. And bring that to y'all attention when it comes down to noticing the symptoms, or the signs, better yet, the signs of the disease progressing. That's really important for y'all to pay attention to, because some of y'all feel like, you have these numbers that can go high and low and it's okay. And that's just not okay. It's not okay at all. And that's a sign that we have a problem. We have, a need to manage the diabetes better. You need to have further diabetic education. And you need to have someone come out and help you. And that's okay too. A lot of us are afraid to admit that we need to help. That's okay. That's what we're supposed to be here to do, right? It's find you somebody that you trust. Find you a diabetic educator. Find you a great nurse. Find you a good doctor, and get the help that y'all need, because ultimately It's your body, it's your life, and it's you that's going to be dealing with the diabetes, nobody else. I'm off, y'all. I will see y'all later. Turn on y'all notifications so y'all can get notified when I go live and we can talk more in details relating to diabetes. And if y'all have any questions, you guys are welcome to ask me the questions as much as possible. It is so hard to see on this thing. Can I elaborate what? It's like the only thing that I see. It's so hard to read your comment, but I'm wondering how you can send me the comment again and then maybe I can see it. I don't know. It's so hard to read that. All I see is, can you elaborate? But I don't know what you need further elaborating on, and what you need more breakdown about. So if you are still on here, you can let me know and I will gladly be able to elaborate to help you out a little bit longer or a little bit further, give you more clarification. As far as where you're possibly, lacking the information, I don't have a problem with doing so. I did break down quite a few things, and I just let me know where you need the clarification, and we can go from there. If you're still on the live, because I'm just seeing that. Excuse me, and then I have a problem with helping you guys, but you know, if y'all do have any questions, kind of make it a little bit clear. Because it's really hard, first off, to see on this platform with this small text, and then tell me where you need clarification in what area, and then I could break it down that way. Okay. I don't have a problem with doing that, so I can help anybody that needs clarifying in any area related to diabetes. But in the meantime, I will catch y'all later, because I think I said it long enough to wait for your response. So you may not still be on the live. Not too sure. But in the meantime, I will catch y'all later. Turn on your notifications so you can get notified when I go live. And I will see y'all again. Take care. It's always this platform. I gotta get another thing.